Rectal sensation, tone, and compliance test, i.e., response to graded balloon distension. The physician performs a rectal sensation, tone, and compliance test using graded balloon distension to evaluate anorectal pathology. Tone tests for relaxation or rigidity in the rectum. Compliance tests the distensibility of the rectum. Sensation tests for fullness and discomfort upon distension. The patient is asked to empty his or her bowels. The patient is placed in left lateral decubitus position with the head lowered 20 degrees. The physician inserts a 2-lumen catheter containing a cylindrical bag into the rectum. 1 lumen is used to inflate the bag, the other is used to measure pressure within the bag. With the distal end of the bag 5 cm from the anal verge, the bag is inflated with air. Inflation is slowly increased and sensation, tone, and compliance monitored. The balloon is deflated when the patient experiences discomfort and urgency lasting more than 30 seconds. Enorectal manometry. The physician performs anorectal manometry to help in diagnosing constipation and/or incontinence due to myotonic dysfunction or suspected cases of Hirschsprung's disease. Hirschsprung's disease is a congenital absence of ganglion nerve cells in the plexus that innervates the colon and/or rectum to relax the internal anorectal sphincter in response to rectal distension. A manometry probe is advanced into the rectum after a digital exam. The probe is slowly withdrawn, taking continuous pressure measurements until the high pressure area of the anal sphincters is located. With the patient relaxed, the basal anal pressure is recorded, and highest pressures are recorded as the patient performs a maximum squeeze. The manometry catheter is inserted again with a rectal balloon that is slowly inflated to the patient's first sensation of fullness, and the volume is recorded. The anal sphincter response to the rectal distension is also recorded. Electrogastrography, diagnostic, transcutaneous. With provocative testing. In electrogastrography, egg, electrodes are placed on the skin over the stomach at a specific distance from each other and attached to a recording computer. Report 91133. When diagnostic egg is performed in conjunction with the administration of a drug in an attempt to manipulate conditions and provoke a measurable abnormality. Liver elastography, mechanically induced shear wave, e.g., vibration, without imaging, with interpretation and report. Liver elastography is a non-invasive procedure for assessing liver stiffness, beneficial in determining the amount of fibrosis and scarring of the liver due to damage, and may also be used to survey any disorder advancement and help evaluate ongoing therapy. A probe is applied to the skin between the ribs, focusing on the liver. The shear wave is mechanically generated, causing the probe to discharge pulses that meet the shear wave and bounce back to the probe. This process allows the shear wave to be measured, which leads to values for liver stiffness. This code indicates no imaging, however, interpretation and report is required.